What's up, America? My name's Jason, and you're watching The Average Conservative. Alright, so before we get started, I just want to give a little bit of a disclaimer. Um, this episode is going to be a little bit long. I try to keep my episodes on the shorter side, 10 to 15 minutes. But with today's topic, I've got so much information, I just don't think I can do it. So just forewarning there. So as far as what is today's topic, well, if you've been following me on Facebook at all, you already know the answer. Today, we're going into COVID-19. Alright, so it's been about 5 months now since we really started to feel the effects of this virus, or I should say, since we really started to feel the effects of our response to this virus. So obviously at the beginning we didn't have a lot of data, we weren't sure which direction to head in, but now 5 months later we do. We know a lot more than we used to know. And for the past couple of weeks in preparation for this video, I've been doing quite a bit of research, and I've got 7 major points that I want to go over, and I'll be probably slipping a few minor points in inappropriate places as well. So, counting down, number 7. No, there is no scientific basis for the 6-foot rule. I have not been able to find any scientifically supported arguments for the 6-foot rule. Now that's not a big issue to me. I like keeping a little bit of space between me and myself and other people in public anyway. And I've also not seen any scientific arguments against it either. It just seems to be something that we've never really looked into scientifically. So, like I said, I don't have a big issue with this, but it seems that there's no scientific support for it. So, number 6, science shows that masks are ineffective at halting the spread of COVID-19. On May 29th, this article appeared in fox6now.com. The World Health Organization is recommending that healthy people, including those who don't exhibit COVID-19 symptoms, only wear masks when taking care of someone infected with the contagion. A sharp contrast from the advice given by American public health officials who recommend everyone wear a mask in public. Also in May, a study out of Hong Kong was published that found no effectiveness in wearing masks when it comes to halting the spread of respiratory illnesses. A quote from the study says, "In our systematic review, we identified 10 RCTs that reported estimates of the effectiveness of face masks in reducing laboratory-confirmed influenza virus infections in the community from literature published during 1946 to July 27, 2018. In pooled analysis, we found no significant reduction in influenza transmission with the use of face masks. Our systematic review found no significant effect of face masks on transmission of laboratory-confirmed influenza. Proper use of face masks is essential because improper use might increase the risk for transmission." Improper use includes such things as wearing a cloth mask repeatedly. Also, Canadian physicist D.G. Rancourt published an article in April stating masks and respirators, sorry about that, do not work. There have been extensive randomized controlled trials, RCT studies, and meta-analysis reviews of the RCT studies, which all show that masks and respirators do not work to prevent respiratory influenza-like illnesses or respiratory illnesses believed to be transmitted by droplets and aerosol particles. Furthermore, the relevant known physics and biology, which I review, are such that masks and respirators should not work. It would be a paradox if masks and respirators worked, given what we know about viral respiratory diseases. The main transmission path is long residence time aerosol particles, which are too fine to be blocked, and the minimum effective dose is smaller than one aerosol particle. And finally, article coming from the New England Journal of Medicine, written by several doctors and public health officials with the title "Universal Masking in Hospitals in the COVID-19 Area." In this article, they state, "We know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. Public health authorities define a significant exposure to COVID-19 as face-to-face contact within 6 feet with a patient with symptomatic COVID-19 that is sustained for at least a few minutes, and some say more than 10 minutes or even 30 minutes. The chance of catching COVID-19 from a passing interaction in public space is therefore minimal. In many cases, the desire for widespread masking is a reflexive reaction to anxiety over the pandemic." And we're beginning to see what this anxiety is doing. We're starting to see reports of people are beginning to attack each other. There is one lady who came upon a couple who were having a picnic in a park. Obviously, you can't wear a mask and eat at the same time, but this lady was caught on camera after she pepper sprayed both the couple and their food, all for just not wearing a mask. There's another case I heard of some guy shooting at a couple of people because they weren't wearing their masks. Another case caught on video of a woman screaming at these kids and telling them she hopes they die because they're not wearing masks in a grocery store, and the list is going on. We're seeing more and more instances of these things. At this point, the science just doesn't hold up that people should be wearing masks in public. And if you live in one of the states where they're beginning to mandate this, I can't recommend that you do one thing or another. You have to decide for yourself. Personally, I would be refusing that mandate on grounds of unconstitutionality. But you have to decide for yourselves what is the morally right thing to do. You have to decide for yourselves what it is you are comfortable doing. Many of us, the answer is going to be that we are going to just decide that for the sake of not stirring up any more trouble than is needed right now, that we're going to go ahead and just wear the mask when we're in public, and kind of just go along to get along. But I think we all know that going along to get along is a dangerous position to take. All right, so point 5. Published science shows that COVID-19 is not widely spread outdoors. A study published April 2nd has found that nearly 80% of all outbreaks occur in home environments where people share living spaces. And the rest, most of them, occur on public transportation, crowded buses, airplanes, trains. That was actually a little bit of a surprise to me. Back in May, I took a trip out to Tennessee, and I was rather annoyed by the airline's requirement that you wear a mask at all times on the plane unless you're eating or drinking. Reading that, I'm a little bit less annoyed. I still don't think that I should have been required to wear it. It should have been a personal choice, but airlines are not the government. They are private companies, and they have a right to run their company the way they want, so I wasn't going to fuss too much. Also, according to a British Columbian health official, there is absolutely no evidence that COVID-19 is airborne. The article states, in an article published in British Columbia, The article states, one of British Columbia's top health officials, however, says medical professionals have a pretty clear picture of how the virus is transmitted. There is absolutely no evidence that this disease is airborne, and we know that if it were airborne, then the measures we took to control COVID-19 would not have worked. Dr. Reka Gustafson, British Columbia's deputy provincial health officer, told CTV Morning Live Monday, "We are very confident that the majority of transmission of this virus is through the droplet and contact route. The overwhelming majority of COVID-19 transmissions occur through close, prolonged contact, and that is not the pattern of transmission we see through airborne diseases," she said. So point number 4, emerging science reveals little to no spread in the community, grocery stores, restaurants, barbershops, and the like. So Professor Hendrik Streeck from the University of Bonn is leading a study in Germany has led a study in Germany, by now it may be finished, on the hard-hit region of Heinsberg, and the conclusions from laboratory work already completed, it's very clear, and this is a quote from Dr. Streeck, "There is no significant risk of catching the disease when you go shopping. Severe outbreaks of the infection were always a result of people being closer together over a longer period of time. When we took samples from door handles, phones, or toilets, it has not been possible to cultivate the virus in a laboratory on the basis of these swabs." So again, this goes back to, why are we panicking over spreading this in public, over going out and catching it, when the studies are showing that it's when we're close together with somebody who has it for an extended period of time, that's when it spreads. Now, obviously, we're talking about a pandemic. It is spreading. It is, jumping. It's not staying within one household, but part of that is because people still have to go to work. We've already found out that, we already know that it takes a couple of weeks before we start to see symptoms, and people don't call in sick or stop going to work until they start to feel bad. So yeah, there is some spread with people. I believe most of the spread outside of the household is going to be in work environments, because those are the people outside of your house that you do still spend a fair amount of time with. So point number 3, evidence, and I would say logic, suggests that it's very rare for asymptomatic people to spread the virus. An extensive study published May 18th in Respiratory Medicine magazine, it studied 455 people who came into close contact with a specific woman. I believe this was on one of the cruise ships that we heard about. But this woman, 5 days later, tested positive for COVID-19, and she never developed any symptoms. So the study, looked at all of the people she came into contact with over those past 5 days, or not over the past 5 days. The study looked at those 455 people, and it found that 0 of them caught COVID from her. None of them. So also, now, obviously that was pretty early on in COVID. People were giving pushback to that article, but as early as as late as June 8th, the World Health Organization made the statement that coronavirus spread by people with no symptoms appears to be rare. And that was a headline for CNN Health. And of course, the World Health Organization got tremendous pushback for that statement. And ultimately they walked it back, but I believe that they walked it back for political reasons, not for any actual scientific purpose. So point number 2, with increased age comes increased risk with coronavirus. Now, this is something that is pretty logically obvious. This is not just something we know about with COVID-19. This is something we've known about with essentially every disease that has the potential to kill. Um, Anyone who has an elderly mother, father, parent, grandparent knows that when you are sick, you don't go visit your elderly relative. You just don't. Because their immune systems aren't as strong, they have a much higher chance of catching the disease from you, and there is always the increased risk that that disease will prove more deadly to them than the average young, healthy adult. This isn't something new. We've known about this for a long, long time. All right, and finally, point number one, the infection fatality rate for COVID-19, also called the IFR, is somewhere between 0.07% and 0.2%, which is in line with a bad flu season. Now, everything we have been doing in response to COVID-19, everything from the lockdowns, the masks, everything that has been come up with is based on early estimates of what this virus was going to do. And again, back then, we just didn't know. So there are early estimates that the IFR of COVID-19 was going to be around 3.4%. Now, that would have been pretty high. Now, for reference, the IFR of the average flu season is 0.1%, while the IFR of smallpox is 30%. The first study to look at the COVID-19 IFR was published April 17th by Stanford researchers, and they found that the IFR rate at the time looked to be between 0.12 and 0.2%, and they speculated that as time went on that would actually be lower. As the first study to be published on the issue, it came under some pretty extreme criticism, and that prompted the lead researcher, Dr. John Ioannidis, to note there's some sort of mob mentality here operating, that they just insist that this has to be the end of the world, and it has to be that the sky is falling. It's attacking studies with data based on speculation and science fiction, but dismissing real data in favor of mathematical speculation is mind-boggling. And on May 24th, the CDC issued what they called their best guess, that the IFR was below 0.3%. And then in a study out of Oxford University states, taking account of historical experience, trends in the data, increased number of infections in the population at largest, and potential impact of misclassification of deaths, gives a presumed estimate for the COVID-19 IFR somewhere between 0.1 and 0.41%. Dr. Ioannidis later published a meta-analysis of 12 IFR studies done around the world between April and May, in which he concluded that the IFRs are in range between 0.07 and 0.2%, corrected to a range of 0.06 and 0.16%, which again puts it in line with a bad flu season. And soon after the Stanford study was released, another Stanford professor who wasn't related to the study, his name was Dr. Scott Atlas, he published an opinion piece in the Hill newspaper. It was titled, "The Data is In, Stop the Panic and End the Total Isolation." And in that he stated the recent Stanford University antibody study now estimates that the fatality rate of infected is likely 0.1 to 0.2%, a risk far lower than previous World Health Organization estimates that were 20 to 30 times higher, and that motivated isolation policies. Let's stop underemphasizing empirical evidence while instead doubling down on hypothetical models. Facts matter. So that's my 7 major points. Now, after hearing all of that information, after me personally, after finding out all of that information, I was asking myself, and you may be doing the same, why is this insanity not only continuing but escalating? And I think the answer, in my opinion anyway, is very clear. Democrats and the leftist media are desperate to get rid of Donald Trump, and they see COVID-19 as their key to doing so. They think that if they just continue pushing the panic until November, then they'll be able to do enough damage to President Trump's campaign by blaming him for not acting for the economy, by blaming him for everything that's going wrong. They'll be able to do enough damage to his campaign to finally get rid of Orange Man Bad. And I believe that it is our responsibility as American citizens, as well-informed conservatives, to get to the polls on November and prove them wrong. So that's all I've got for you. Be sure to hit the like button, subscribe, hit that notification bell so you don't miss any future episodes. Don't forget, you can find me on social media. I'm just about everywhere at this point. And if you're interested in maybe showing a little extra support, you can also find me on Patreon. Other than that, peace.